M7824 or bintrafusp alpha is a novel agent that not only targets PD-L1 as an antibody, but on the Fc portion of the antibody, it has two TGF-beta receptor 2 molecules that can sequester or trap TGF-beta, thus targeting both PD-L1 as well as TGF-beta, removing that from the biology implications in the tumor microenvironment. So we did the first in-human study of M7824 at the National Cancer Institute. We did the dose escalation starting with 0.3 going up all the way to 30 milligrams per kilogram with bintrafusp alpha. What we saw was that it was safe. We got similar type of side effects as one would expect to get with anti-PD-1 or anti-PD-L1 agents, with the addition of keratoacanthomas, which is often seen with the inhibition of TGF-beta. We also noted more recently that there's been some low-grade bleeding events like gingival bleeding that has been seen with this. This has also been associated in previous studies with TGF-beta inhibition. What we found in that phase 1 study was that at doses of 3 milligrams per kilogram and above, you could get complete saturation of PD-L1 throughout the entire dosing period, every 2 weeks, and you could also sequester all the activated TGF-beta in the serum. So the levels of TGF-beta were below the lower limit of quantitation of the assay. We also noted in that very first study that there was some evidence of clinical activity. We had 2 partial responses and a complete response in those patients. And actually, interestingly, several of those responders were patients that had HPV-associated malignancies. We went on to do multiple dose expansion cohorts, and in those dose expansion cohorts, we enrolled patients with head and neck cancer, with cervical cancer, and so we were able to get more data from HPV-associated malignancies. Here at the American Association of Cancer Research meeting, we showed the responses in those patients with HPV-associated malignancies. So these included patients with anal cancer, patients with cervical cancer, and patients with head and neck squamous cell carcinoma. What we found was that, again, we saw pretty good response rates in these patients. What we saw was about a 35 to 40% response rate, depending on whether these were patients with HPV-associated malignancies only or HPV-confirmed malignancies. The majority of them were confirmed, and the response rates were approached 40% in those patients. What we also looked at was the depth and duration of the responses. So what was, I think, pretty interesting to see is that you got really deep responses with these patients getting this bintrafusp alpha. And these responses were very prolonged, so that you looked at the overall survival of these patients, and you're looking at the 12-month overall survival above 50%, which was quite good for this patient population. The duration of response, the responses were maintained in 11 out of the 15 patients at the time of data cutoff, and with a median follow-up of over 16 months. So this was, again, suggestive that we were getting really good activity in these patients. Now, to put this a little bit into context, what we've seen with PD-1 inhibition in patients with HPV-associated malignancies are response rates between 15% and 24%. So this it's difficult to compare across different studies, but this suggests that we're getting good activity, at least as good as we've seen with the PD-L1 and PD-1 inhibition in this disease category. It's interesting to note, the discussant today noted that E6 and E7 HPV proteins can actually cause an increase in TGF-beta production. So it can bind to the transcription, driving the transcription of TGF-beta. So perhaps this is why targeting not only PD-L1, but also TGF-beta is important in the HPV-associated malignancy setting. So I think the clinical implications for this type of therapy is we need to do additional studies. There's an ongoing phase 2 study at the National Cancer Institute that is taking all HPV-associated malignancies. But I think we need to, if these results are confirmed, I think this will lead to a registration pathway for this agent in HPV-associated malignancies.